خلاص صحيح. أو فيها مشكلة. فيها مشكلة. يعني تجي في الجامعة. حل الجامعة.
اقول لك عيني تسمعني مصطفى؟
نعم دكتور واضح.
شو ما دي يطلع لي recording the meeting has been recorded by the host.
نعم دا
شو
سجل.
من دي يتفاعل؟
لا هو دا سجل ريكورد.
زيد
نعم دكتور موجود زيد جواد.
السلام عليكم مصطفى.
عليكم السلام اهلا عمي.
عليكم السلام دكتور شلونكم؟
عيني زيد ويانا انت حبيبي؟
اي عمي.
اوكي اذا انتم جاهزين بس دا الاحظ اكو بعض الارقام مسجله ايفون
وايباد. نعم
ايباد. فذولا ترى يعني من الملاحظه يعني اللي مسجل ايفون حيمتحن بس ترى درجه صفر راح ما تحسب له. فلو يطلع ويدخل مرتلخ باسم مثل ما اتفقنا، يا اما خليه يبقى ايفون بس يعني ما يجي بس مجرد يطلع على الامتحان يعني لانه هو درجه زيرو راح تكون. يعني
هم
الاسماء
العفو بس اذا ممكن بس
أسماء
انا قلت لهم اذا بس ممكن يعني بس يغيرون الاسماء او من يدخلون على هذا
بعد
بس.
اني هم قلت لك يعني مثلا اكو فرح ام 12 مثلا فرح ام 12 شنو يعني ما هذا اسماء مو يعني اما اسماء واضحه مثلا هنا الدكتور مراد عدنان، هند عباس جاسم، زيد جواد، علي عزيز، ذول الاسماء واضحه يعني. اذروايز اي واحد اسم نيك نيم يعني حتى ما مقبول الاحرف. نور ام مثلا هيك اسماء، نور وحده بس نور، ريلام ام ار اكس 22 2 هاي كلها اسماء يعني هو من حقه ان يشارك بالامتحان ولكن الدرجه يعني ما تعتبر شيء لانه ما معلن بالاسم منو هذا. وان شاء الله خير. اذا جاهزين نبدي بالامتحان عيني.
هو عمي اذا بس ممكن ننتظرهم شويه، هم اعتقد هسه جاي يطلعون، اذا هاي بس هم يقدرون يطلعون ويرجعون مره ثانيه على بس يدخلون الاي
عادي
دي،
عادي
الميتنج اي
عادي
دي.
عادي على راحتك.
اي
شو وقت ما
من
تكون انت
يدخلون الميتنج
جاهز
اي
قول لي.
اي اي
هو بس مجرد يعني لا، هو مجرد هو شنو يسوي ريجستريشن على الزوم باسمه الحقيقي. يعني
نعم.
من يقول
اي
يعني اسمه يكون يخلي اسمه، بعدين يدخل كاسم. من يدخل راح يدخل يدخل الاي دي والباسورد.
مم.
اوكي.
نعم دكتور. هو اعتقد بقت اسماء قليله بس، اذا ريال مي هذا ار اكس ده ممكن دكتور زحمه عليك، كان بس غير الاسم.
اي اوكي يعني
ودكتوره نور ام
اي
بس
يعني
هاي الاسمين اعتقد.
اي شوف اكو اسماء، اي اسماء
دكتوره زهراء.
غير مو واضحه يعني.
نعم.
اكو احمد
زوم
ايباد،
يوزر،
زوم
اكو واحد
يوزر.
اسمه زوم يوزر احمد ايباد. يعني هاي الاسماء النيك نيمز يعني حرامات. هو يشارك وهذا وراها درجه هي ما تنحسب. واذا هو يريد يعني يشارك بنيك نيمز، يكون مع ناس العفو ما تريد يعني تعبر عن اسمها، فهذا اتس اب تو هيم يعني ما يهمني ترى، موضوع على راحتكم يعني.
نعم.
انتظر 5 دقائق زيد، انتظر منك الاشاره حبيبي.
عمي انتظر دقيقتين ان شاء الله.
اوكي يلا ام ويتنج.
ان شاء الله.
لا ما داروا.
ده وحش من عايزة تفتح من الجزيرة.
الدكتور مصطفى العفو تسمعني؟
نعم استاذ اسمعك.
الريكورد وقفه حاليا لانه
حاضر.
من يبدي
لا.
امتحان طبعا اكيد هي المشاركه لكم. طبعا هو عباره عن هذا اسسمنت، راح يكون يعني مجموعه من الاسئله تكون بيست اوف 5. غالبا يعني حاول تختار الاسئله تكون بمستوى البورد، وبعضها هي سهله وبعضها شويه بصعوبه، باعتبار هذا اول امتحان حتى يصير رد فعل. خلينا نقول ستيب 1. الستيب 2 راح تكون شويه اصعب، ستيب 3 راح تكون اصعب اكثر. فيعني اليوم راح تشوفون الاسئله سهله يعني بدايه ان شاء الله. وان شاء الله طبعا الامتحان حيكون على شكل 3 ستيبس، ومجموعها ذني راح يكون اول وثاني وثالث. طبعا اكيد له جوائز ان شاء الله. ارجو ان تكون الماده مفيده ان شاء الله. دكتور مصطفى، يعني نبدي بالسؤال الأول إذا كلكم جاهزين. share your screen.
عفوا دكتور، بس الإجابة هي شو راح يصير عن طريق الشات؟
راح الدكتور مصطفى هو حيكون ويانا اورجنايزر وراح يفهمكم على التفاصيل يعني.
نعم.
دكتور راح تطلع لكم، راح تقرون السؤال هسه من دكتور علي، راح يبدي يعرض السؤال ان شاء الله، وبعدها راح يطلع البول بالتوب 5 الاجابات وتجاوبون ان شاء الله. بس ثواني.
اتصور السكرين واضح.
نعم واضحة دكتور.
اوكي. السكرين طبعا اللي عنده سؤال او عنده فد مشكله يعني يقدر يعني يكتب على الشات. دكتور مصطفى راح يتابع اذا اكو مشكله باجابه او سؤال احد ما واضح عنده، بس يعني غالبا على الزوم يكون موضوع ستيبل ان شاء الله. اوكي، اذا مستعدين نبدي بالسؤال الاول
تمام.
ان شاء الله. A 1-year-old female presents to your clinic icterus and dark urine. She denies any fever, abdominal pain, or weight loss. The examination is unremarkable except for yellow discoloration of the skin. Total bilirubin is 6 milligram per deciliter. The direct bilirubin is 5.1. AST is 84 unit per liter. ALT is 92 unit per liter. Alkaline phosphatase is 662. CT scan has been done of the abdomen and was unremarkable. Right upper quadrant ultrasound shows a normal gallbladder but does not visualize the common bile duct. What is the most appropriate next management step? A. Antibiotics and observation. B. MRCP. C. Hepatitis serology. D. HIDA scan, HIDA scan. E. serologies for antimitochondrial antibodies. طبعا يرجى من جميع يسوون ميوت بلا زحمه للصوت. دكتور مصطفى، لانش الجواب خلال 30 ثانيه. الإجابة تكون عيني بلا زحمة، الإجابات تكون على السلايد.
لا هسه
دكتور
راح
مصطفى ممكن توضيح الموضوع؟
راح يطلع لكم بول، دكاترتنا راح يطلع لكم بول ويجاوبون، بس اقروا هسه راح تطلع لكم الإجابات. هسه راح نعرض شلون تختارون دكاترة.
الإجابة تكون انتراكتيف مو بالشات، لا تكون الإجابة بالشات،
راح يطلع لكم
الإجابة تكون على السلايد.
طلعت لكم
بالضبط.
the most appropriate one.
اختار الإجابة وسوي سبميت. 30 ثانية. دكتور مصطفى التايمر يمك؟
نعم دكتور، بعد 12 ثانية. انتهى الوقت دكتور.
الوقت انتهى طلاب، الوقت انتهى. الآن نسوي ديسكشن على الإجابة. طبعا السؤال الدايجنوزز از برايمري بلياري كولنجايتس. إذا أمكن الديسكشن بول، طبعا previously سابقا ERCP was used for diagnosis and as a part of diagnosis therapeutic. Now MRCP is of high sensitivity and specificity to accurate visualization due to the updated software protocols. Primary biliary cholangitis is possible, but it more in female at 50s and 60s decades, and in such case scenario malignancy is suspected and must be excluded. الإجابة طبعا هي الMRCP. الإجابة هو الMRCP. سؤال واضح وبسيط، فبعضهم يحتاجون إلى يعرف اختيار هو الMRCP. Now السؤال الثاني question 2. Question 2. A 41-year-old female presents to the clinic with a week of jaundice. She notes pruritus, icterus, and dark urine. She denies fever, abdominal pain, or weight loss. The examination was unremarkable except for yellow discoloration of the skin. Total bilirubin was, and the direct bilirubin is 5. It is exactly the same scenario, but the patients on doing MRCP was done with revealed moderate dilatation of the CBD. It was about 9 millim. طبعا normal CBD is less than 5. هنا طالع 9 with suspicious distal CBD structure. No falling defect was detected. What is the most appropriate next management step? هل هو antibiotics and observation, orthodeoxycholic acid, tumor markers, endoscopic ultrasound, or to do ERCP? هسه دكتور مصطفى طلع الإجابات. 30 ثانية، خلال 30 ثانية تتم الإجابة. دكتور مصطفى 30 ثانية يعني.
Time's up in 3 seconds. 2 1 انتهى. done.
انتهى الوقت. انتهى الوقت الإجابات. طبعا الدسكشن لهذا السؤال هو انه البيشنت when you have a patient with suspicious structure, so the new entity is to do presence of any suspicion structure, whether it is malignant, whether there is surrounding malignant lymph nodes, and also we can visualize the pancreas and also the vascular pattern in addition to the pancreatic ducts. All these can be visualized with good magnification, with high sensitivity and specificity than the in comparison with the CT scan and MRI. So why we don't ليش مختارين antibiotics and observations? Because it is the false. There is no use for structures or obstruction. It is used for the support of patients in primary biliary cholangitis. Tumor markers is not the solution. Next step. The ERCP now is used only for the therapeutic. انشال موضوع ال ERCP كdiagnostic. الإجابة اللي سأل هذا السؤال ليش مو ERCP؟ ال ERCP أصبح الآن فقط للtherapeutic because of the risk associated during this intervention procedure, and because the endoscopic ultrasound now it is the less invasive and give you a good visualization. السؤال الثالث question 3. تفضل. 61-year-old male is admitted to your service for swelling of the abdomen, and you detect there is an ascites on the clinical examination and perform a paracentesis. The results show wide VC is 300 leukocytes per microliter. Peritoneal albumin level is 1.2 gram per deciliter. Protein is 2 gram per deciliter, and the triglycerides are 320 milligram per deciliter. Peritoneal cultures are pending. Serum albumin is 2.6 gram per deciliter. Which of the following is the most likely diagnosis? A, congestive heart failure. B, peritoneal tuberculosis. C, peritoneal carcinomatosis. D, chylous ascites. E, bacterial peritonitis. شوي هذا السؤال يحتاج لتركيز. ممكن تعرض الإجابات. الإجابة خلال 30 ثانية.
تايمز اب دكتور سديد.
تايمز اب سدها. الدسكشن الإجابة A, congestive heart failure. السبب طبعا أنا كلش يعني الموضوع بسيط، انه اول من نحسب لازم نحسب الساج ريشيو. الساج ريشيو اذا نحسبها حتكون اكثر من 1.1 تقريبا 1.5 and this indicates that there's a high gradient and the high gradient بعضهم يقولون ليش بنقول chronic liver disease او others. طبعا الجواب لان total protein is more than 2.5. اذا نباوع عنا على التوتال بروتين. اذا كانت more than 2.5 هذا يمشي ويا الكاردياك كوزز، اما اذا less than 2.5 فهذا هو يمشي مع الكرونيك ليفر ديزيز. اذا ممكن ميوت، اذا ممكن ميوت ار ممكن ميوت. اوكي طبعا هذا الجدول دكتور مصطفى. اكو جدول اخر اني خاله اي عشيدك. هذا الجدول يلخص اذا كان ratio more than 1.1 less than 1.1 according to the total protein. If less than 1.5 sag ratio less than 2.5 total protein يمشي ممكن يكون cirrhosis او acute liver failure. اما اذا كان less than 2.5 with less than 1.5 the sag ratio تمشي النفروتيك او mixed edema. هذا بالجدول الاول على اليسار والreadings of total protein more than 2.5 فهذا ممكن يكون Budd-Chiari syndrome and veno-occlusive diseases. Otherwise, any other causes, it may be malignant or pancreatic inflammatory conditions. الإجابة السؤال الرابع question 4. السؤال الرابع 50 years old male presented with history of acute epigastric pain in the last 4 days associated with nausea and vomiting. He stated that the pain became very severe in the last 24 hours. The pain was radiated to the back, aggravated by lying down. On examination, there is severe epigastric tenderness. He is an case of poor controlled diabetes. On examination, he is on taking history, he is using oral hypoglycemic agents. He denied using any OTC drugs in the last 2 weeks prior to his admission. An investigation was shown that there is mild increase in the level of ALT 1-fold, serum amylase and lipase more than 3-fold, All other investigations were normal. Apart from high fasting blood sugar, HbA1c was 9.4. CT scan was done for him and show features typical of acute pancreatitis, and no mass was noted. TG and LDL moderately elevated. After 3 days of supportive management, the condition improved. Ultrasound was done 5 days after admission. It was normal. The patient started oral feeding after 48 hours without any vomiting, and no previous hospital admission. What is the next step in the management? A, repeat serum lipase after 1 week. B, CT scan for the abdomen after 1 month. 3, C, discharge the patient with supportive management by using painkillers. D, we must do OGD. E, EUS. دكتور مصطفى لانش الإجابات إذا أمكن 30 ثانية.
Time's up دكتور.
Time's up. Time's up. طبعا تركب هذا السؤال انا يعني سابقا اللي مداوم وياي يعني هوايه ذاكره. A patient القاعده golden rule. Any patient 50 years and above presented with history of pancreatitis and the cause is not significant and the إذا أمكن ميوت بلا زحمة عليكم. بلا زحمة عليك. إذا أمكن ميوت. For any cause of golden is that any patient 50 years and above, and he presented with history of epigastric pain and diagnosis of acute pancreatitis and unknown etiology, we must do, the patient is 50, we must do endoscopic ultrasound to exclude hidden malignancy, and this is according to the ACG guidelines 2015, especially in patients with CT negative. EUS is highly recommended to exclude any hidden pancreatic malignancy. طبعا هذا الاسباب طبعا هذا جدا حلوه انه what are the etiological clues in acute pancreatitis. طبعا هاي جدا مهمه وتعطي تريكس. واحده من عندهن يقول لك more than threefold are the best laboratory indication for a biliary acute pancreatitis. يعني اذا واحد جاك suspicion of acute pancreatitis وعنده elevation of the ممكن يكون hidden biliary pancreatitis يعني stone passer. Normal gallbladder ultrasonic finding do not exclude biliary pancreatitis. Finding of gallbladder sludge at the presentation is equivalent to finding of gallstone. Subsequent development of sludge is a common in fasting and ill patients. Acute pancreatitis. Usually the triglycerides more than 1,000. Amylase level may be artificially normal, and this is maybe need to revision. بالنسبة triglycerides value decrease rapidly when a patient is taking nothing by mouth. يعني طبيعيا إذا كان patient acute pancreatitis we will keep him null by mouth. فمن حنسوي level for triglycerides automatically راح نشوفها أقل وهاي ما تعتمد عليه ولهذا we should recheck after he regain the normal feeding. Serum calcium may be normalized in patients with severe acute pancreatitis, and it should be rechecked after resolution of the cause if the cause is not indicated. الترك الأخرى, remember, cancer in patient older than 50 وهي ذكرناها, it's about 2% of acute pancreatitis and 5% patient pancreatic cancer present acute pancreatitis. If a patient is young and acute pancreatitis is idiopathic or recurrent, consider genetic causes. هذه الإجابة. سؤال خامس, question 5. سؤال بسيط. الإجابة سريعة. Which of the following condition is associated with increased the perception of reflux episodes? reflux قصدي يعني GERD. هل هو أولاً anxiety disorder، 2 Barrett esophagus، C diabetes mellitus، D older age، E sleep. Which of the following condition is associated with increased perception of reflux episodes?
Time's up دكتور. Done.
Time's up. إذا ممكن discussion. طبعا correct answer is the A, anxiety disorder. طبعا كل واحد عنده anxiety, the perception is high, and think of hypersensitive esophagus. But in case of diabetes and old age, the reverse is true. ونعرفها اللي ما عندهم pain perception. طبعا هنا يفتح لنا باب انه واحده من فوائد ال pH metry للبيشنت اللي chronic reflux. واحد يذكر انه ال pH metry اللي هو 24 pH impedance شنو ممكن يقول لنا؟ طبعا هذه نقطة جدا مهمة. أول نقطة يقول لنا إذا كان أكو true pathological reflux or not، ويقدر يقول لنا إذا كان البيشنت عنده hypersensitive esophagus راح يظهر ال hypersensitivity in a force of the impedance يعني in a part of numbers. وممكن يقول إذا كان هو non-pathological reflux أو يكون non-acidic reflux. فذني الأشياء اللي ممكن يطلع لنا ال pH مثل خلال 24 hour، وبالتالي كل وحدة لها line of management خاص بها. السؤال السادس. Question 6. "30-year-old woman is involved in a motor vehicle accident and sustained a bruise across her abdomen for the seat belt. A multiphasic CT abdomen performed and ruled out any intra-abdominal injury. Show there is a 6.5 cm homogeneous mass in the inferior right lobe of the liver. The mass show contrast enhancement in the early arterial phase and rapid return to iso intensity with the rest of the liver in the portal venous phase. The mass appears to have a small central scar. To distinguish between the focal nodular hyperplasia and hepatic adenoma, MRI is performed with the contrast agent done. The mass shows contrast retention on 20-minute delayed image. No other intra-abdominal pathology is seen. What would be the appropriate next step for this patient? A, biopsy of the mass and immunohistochemistry staining for the nuclear beta-catenin. B, surgical resection. C, radiofrequency ablation. D, do conformal external beam radiotherapy. E, no further treatment. طلع الإجابة دكتور.
Time is up دكتور.
Time's up. Discussion. طبعا مبين من هذا هو البيشنت discovered to have طبعا discovered as a liver mass incidentally typical feature of focal nodular hyperplasia. هاي الفيتشرز اللي قلناها بالايمج ستدي تمشي مع FNH with rapid homogeneous enhancement in the arterial phase which return to the isointensity in the portal venous phase, and the presence of central scar contrast retention in the delayed hepatobiliary phase. طبعا الفوق nodine wire chemistry for beta catenin indication detection whether hepatic adenoma are the risk of mega transformation, and it is not indicated in FNH. Surgical resection is indicated only if it's symptomatic. في الإجابة هي do nothing. Question 7. "50-year-old alcoholic man comes to the clinic complaining of back pain for 8 weeks and jaundice for 3 days. He is hemodynamically stable. Laboratory test results include the following: AST 6,145, ALT 5,090, total bilirubin was 4.6, INR was 2.3. Which of the following is the most likely diagnosis? A. Alcoholic hepatitis. B. Acetaminophen toxicity. C. Acute hepatitis A. D. Shock liver. E. Choroidocholithiasis. طلع الإجابات دكتور مصطفى عيني.
تايمز اب دكتور.
تايمز اب. طبعا الإجابة واضحة، هذا patient ولا يغرك انه alcoholic او لا، لانه ال ALT وال AST is very high, more thousands, so you should discover that you should think about drug-induced injury, DILI. Although viral hepatitis and shock are the possible diagnoses, but the history of back pain suggests diagnosis is most likely related to the drugs. In addition, if the patient has acute hepatitis A, the ALT to AST ratio would be more likely greater than 1.1 to 1, and would be generally present as physically unwell. With the past gallstones, rarely the enzymes level is to go for several thousands. بين قوسين إذا كان يعني past يعني stone راح تكون بال يعني around 300 to 500 not more. Now question 8. A 22-year-old woman presents with 6-week history of bloody diarrhea. Symptoms began after she returned from a 1-week vacation in Mexico. She reports that there's a 4.5 kg weight loss over the past 6 weeks. She has 1 to 2 nocturnal stools with 6 to 8 bowel motions during the day. She experienced urgency 30 minutes after meals. She has abdominal pain and is relieved by passage of stool, and she has intermittent bloating without nausea or vomiting. She used non-steroidal anti-inflammatory drugs once or twice weekly for headaches, but she has not used antibiotics recently. There is no any family history of IBD, an inflammatory bowel disease. She is sexually active. Which of the following is not a reasonable next step? Is not. طلاب, is not a reasonable next step. A. Urine pregnancy test. B. Stool culture. C. Stool assessment for Clostridia difficile dioxin. D. Colonoscopy. E. Loperamide before meals.
تايمز اب دكتور.
تايمز اب طلاب. طبعا منطقيا اذا نرجع على واحد urine pregnancy test is important because we should discover that the patient pregnancy because she's sexually active, so we cannot do CT scan for the abdomen. Regarding stool culture is because we need to know to what type of infection, because CT still a possibility even the patient antibiotics. Colonoscopy also may be needed to exclude any cause of the, because she has abdi flag, you know, that bleeding per rectum or chronic bloody diarrhea. And loperamide before meals is a false answer because we cannot use the antidiarrheal agents in patient suspicion of infection. وهذا يعني منطقي ومعروف. السؤال التاسع. Question 9. "28 years old male with established pancolonic ulcerative colitis, presents with increased frequency of bowel movements over the past week. His stool frequency was 1 to 2 bowel movements daily at a baseline, has increased to up to 4 motions per day. He reports no hematochezia, nocturnal stools, or any abdominal pain, weight loss, or recent antibiotic use. He reports no, يعني هذني كلهن ما عنده. He had been in a clinical remission with 5-amino salicylic acid therapy for the past 4 years. He denies missing any doses of his medication. Which of the following is the most appropriate next step? هل we are A, start corticosteroid therapy, B, change to different 5-amino salicylic acid, C, test the stool for Clostridium difficile toxin, D, recommended colonoscopy, E, recommended for CT enterography. الإجابات.
Time's up دكتور.
Time's up. A discussion. طبعا أكيد any patients who develop an acute attacks of diarrhea, all of a sudden should exclude the infection. The most common cause of infection is the Clostridium difficile infection, which is dramatically increased in the population, and especially in inflammatory bowel disease, which means that inflammatory bowel disease patients we not need to ask or review that the presence of any use of antibiotics, because these infections can occur in IBD outpatients even without any antibiotic exposures. IBD-directed therapy should not be adjusted until infection is excluded. وهي نقطة جدا جدا مهمة. We cannot optimize the management within the infection. And in the case of Clostridium difficile, it cannot detected unless we send for the stool A and B antitoxin specific for the Clostridium difficile or the sending for the PCR. وهذا هو الإجابة طبعا تكون إذا Clostridium difficile. السؤال العام 10. A 24-year-old female with established Crohn's ileitis presents for follow-up medical evaluation. She wants to become pregnant. Which of the following is true? A, methotrexate is believed to be safe with pregnancy if folic acid is co-administered. B, fertility is reduced in all IBD patients. C, women in remission before pregnancy are more likely to remain in remission during pregnancy. D, pregnancy is contraindicated in patients with an ileostomy. E, IBD flares are most common in the 3rd trimester. الإجابات.
تايمز اب دكتور.
تايمز اب، اغلق الاجابات. اوكي، ما احنا خلصنا 10 اسئله، خلصنا نص الامتحان لحد الان. دكتور زيد، باعتبارك الممثل المجموعه، اكو عندك فد تعليق؟ اكو فد شيء يعني صعب؟
لا عشتك عمي.
اوكي، الدسكشن مع السؤال العاشر. طبعا الwomen in before the pregnancy still طبعا access contraindicated for sure. and مو بس هذا، احنا لازم نتاكد اذا كان البيشنت يستخدم الليزر تي اكس، وعاده هو يستخدم لازم نتاكد انه قبل ما تكون الفيميل plant should stop the MTX 3 months before going to see الدايبريم والاميوران سيفتي. طبعا مهمه هواي منهم كلش بكثره انه البيشنت انه العامل الاجابه هي هاي كالتالي: more than 400 reports would be evaluations and there or consistency in the malformation has occurred. بين قوسين اذا كانت patients already على اميوران وهي stable وصار pregnancy، ماكو داعي لقطع الاميوران او الازدايبرين باعتبار الازابارم have no such risk، يعني يدعي الى التوقف. The authors concluded that the associations between the thyroid prematurity and congenital malformation were likely owing to the confounding effects of the disease activity. يعني بين قوسين شافوا إذا كان اكو malformation فهي related إلى disease rather than the السؤال 11. Question 11. هذا شوية يعني يا شوية تركزون بيه. 80 years old woman is evaluated for a complaint of involuntary weight loss. Her baseline weight at her clinic visit 6 months ago was 67 kg. She reports that her appetite got 2 months ago when she food no longer had the same. Accompanies her to the visit and reports that her on. Her daughter also notes that her mother seems more forgetful and her home has become has a history of hypertension and peripheral vascular disease, ischemic attack 6 years ago, but has never had a stroke. There have been no recent changes in any medications. Her weight in the clinic today is 60 kg. What is the next appropriate approach for the evaluation of this patient's weight loss? A, ask the patient to return to the clinic in 1 month for a repeated weight evaluation. B, order the thyroid function test and perform a mini mental state examination. C, refer for OGD. D, reassure that the patient and her daughter that normal. E, refer for colonoscopy. الإجابات:
تايمز اب دكتور.
تايمز اب. طبعا هنا أنا شويه تركي انه كل واحد يحكي انه هذا 8 years old ويحتاج عنده weight loss فلازم يسوي colonoscopy. الاجابه انه not go rush for the invasive test although the weight loss is a red flag. before decision to do invasive procedures, especially in the elderly patients, we should exclude the thyroid disease, dementia, dentations, depression, and other possible associated medical conditions. وهذا معروف. Even the patients is in elderly, we should exclude the other medical causes. Question 12. A 47-year-old male man is evaluated in the emergency department for chest pain that developed at a restaurant after swallowing a piece of steak. He reports intermittent episodes of meat getting stuck in his lower chest over the past 3 years, but none as severe as this event. He denies food regurgitation outside of these episodes or heartburn symptoms. He is able to swallow liquids without difficulty and has not had any weight loss. Which of the following is the most likely diagnosis? A, achalasia. B, adenocarcinoma of the esophagus. C, esophageal diverticula. D, Plummer-Vinson syndrome. الإجابات.
تايمز اب دكتور.
Time's up. طبعا الإجابات يعني مصطفى.
عفوا.
اوكي. طبعا هنا الإجابة هي سكات سكيرينج. سكات سكيرينج راح نجي عليه. طبعا الأكليجيا مو منطقي يكون أكليجيا لأنه هذا البيشنتس يعني ما عنده فيتشرز اوف أكليجيا. أكليجيا is more progressive. الأدينوكارسينوما of the cannot say so. The esophageal diverticula ما عندك features of gargling or upper part of the esophagus because the features associated with stacking the food in the lower part of the esophagus. Plummer-Vinson syndrome ما عندك features of severe iron deficiency anemia. سكات سكيرينج هي الإجابة. طبعا إذا تعبر على السلايد الدسكشن مصطفى. طبعا السكات سكيرينج typically occurs in the persons older than 40 years and often causes something called steakhouse syndrome from meat getting stuck in the ring, and the rings are easily treated with dilatation. طبعا السلايد اللي ورا إذا تراوين إياه مصطفى بلا زحمة. واحد يسألني شنو سكات سكيرينج؟ سكات سكيرينج the definition of scat scaring is a ring is made fibrotic ring is made on the top of hiatus hernia with a patient with a chronic GERD. يعني chronic GERD لفترات كلش طويلة راح يصير fibrosis as a part of protective mechanism فيصير هذا الرنج اللي موجود. وعادة إذا كان symptomatic فحلوله بالاندوسكوبيك either by balloon dilatation أو by trimming by using a special device in 4 quadrants. يعني نجيب في جهاز خاص يحاول نسوي tearing of this ring in 4 quadrants وينفتح هذا الرنج. طبعا أكيد after that we should treat the cause of the GERD. Question 13. A 45-year-old woman with a 25-year history of mild ulcerative colitis reports a 2-month history of persistent right upper quadrant abdominal discomfort. She is otherwise in good health and has an ECOG performance status of the liver ultrasound of 1. ESG of 1. Liver ultrasound shows 7 cm mass in the superior right lobe of the liver. MRI performed for further evaluation shows a mass on T1 weighted image that is hypointense with lobular margins and show minimal enhancement in the arterial phase with progressively increasing enhancement through the venous phase. In addition to the porta hepatis, the porta hepatis has mated lymph node measure 3/4 cm that are suspicious of metastasis. MRCP shows that the peripheral bile ducts has a chain of lakes appearance, which suggests previously unrecognized primary sclerosing cholangitis. Percutaneous biopsy of the mated lymph nodes confirmed diagnosis of adenocarcinoma, likely of the upper part of the GIT, with a biliary or pancreatic origin. Colonoscopy and OGD was done, and both was negative. CA1990 marker is 2,550. What is the most appropriate management of this patient? هل هو best supportive care only? A. B. Orthotopic liver transplant. C. Transarterial chemoembolization. D. Combination chemotherapy with gemcitabine and cisplatin. E. Treatment with the multikinase inhibitor sorafenib. الإجابة
تايمز اب دكتور.
الدسكشن الإجابة هي طبعا راح تكون the use of in case this patient before his advanced stage intrahepatic cholestasis and is best treated with combination of chemotherapy, which is the gemcitabine and cisplatin. شوية إجابة صعبة. والتريتمنت of cholangiocarcinoma advanced metastasis chemotherapy شوية يحاول يسوي refreshing of the chemotherapy. العفو دكتور مصطفى، إذا ممكن إجابة الأرقام المشاركين ايش تزيد وتقل؟ هل أكو ناس تدخل؟
نعم دكتور، اكو ناس يدخلون بس نفس الاكونت يدخل ويطلع، يجوز السبب انقطاع النت يمهم.
لا مو رقم ثابت 44 يصعد 47 48
المهم
على كل
50 بلس ماينس ده يصير يعني مدى يوصل.
اذا امكن بالامتحان الاخر يعني الناس يوم كانت تجربه بالامتحان الاخر بعد من نبدي بعد ما حد يدخل، اذا امكن حتصير خربطه تعرف الاسماء والاجابات تكون نص نص. اوكي
تمام دكتور.
من يبدي الامتحان بعد خلاص صحيح حتى الناس تعرف انه اكو تايمز اوف ذا اكزامينيشن
بعد ما حد يدخل.
اوكي فالاجابه هي دي. اوكي عاش ايدك. Question 14. "36-year-old female with non-case of AIDS and the CD4 count was 35. Presents with odynophagia and progressive dysphagia. The patient reports daily fevers and there is a 20 pounds weight loss. She has been treated with clotrimazole and touches with her throats without relief. On the physical examination, the patient is cachexic with a body mass index of 16, the weight about 86 pounds. She has temperature of 38.2 degrees centigrade, which means that she's febrile and is noted to be orthostatic by blood pressure and pulse. Examination of the oropharynx reveals no evidence of thrush. The patient undergoes OGD, which reveals serpenguous ulcers in the distal part of the esophagus without vesicles. Serpenguous ulcers in the distal part of the esophagus without vesicles. No yellow plaques are noted. Multiple biopsies are taken that show intranuclear and intracytoplasmic inclusions in large endothelial cells and fibroblasts. What is the best treatment for this patient's esophagitis? A. Ganciclovir. B, glucocorticoids, C, fluconazole, D, foscarnet, E, thalidomide.
تايمز اب دكتور.
Time's up. طبعا هذا typical features of patients who have ulcers in immunocompromised patients like patients with AIDS. فالجواب هو cytomegalovirus infection. طبعا هذا راح يعطينا في ريفيو سريع على ال causes of esophagitis in patients immunocompromised. In patient HIV, various infection can cause the disease, including herpes simplex, cytomegalovirus, and varicella zoster. but كل واحد candida and HIV itself. طبعا نجي على واحد. طبعا اللاك اول نقطه انه the lack of thrush does not rule out the candida as a cause of esophagitis and OG is necessary for diagnosis. وهي نقطه جدا جدا مهمه. السايتوميجالوفيروس classically will cause serpingous يعني ulcers تكون serpingous يعني تكون على شكل تشبه الديدان serpingous in the distal part of the esophagus that may coagulate to form giant ulcers. Brushings alone are insufficient for diagnosis and the biopsy is a need. Well, usually the biopsy should be done revealed طبعا from the bases and from the centers of these ulcers. Biopsy revealed intranuclear and intracytoplasmic inclusions. طلاب هاي جدا مهمة تجي هواية مسكوات انه اذا قال لك reveal intranuclear and intracytoplasmic inclusions هاي clue to go for cytomegalovirus with a large nuclei in the large fibroblast endothelial cells. Given her notable swallowing symptoms, IV ganciclovir is the treatment of choice for course. إذا واحد يقول أكو oral نعم اللي هو الفال ganciclovir is an effective oral preparations. أما الفوسكارلت is useful treatment ganciclovir resistant cytomegalovirus. يعني إذا كان patient طينا ganciclovir أو valciclovir وصار resistant نقدر نستخدم الفوسكارنت. بالنسبه للهربس سمبلكس طبعا عاد كلمه as a part of vesicles. هو قال لك non vesicles. اذا كان vesicles بيها and as a part of punched out lesions in the esophagus with the characteristics finding on biopsy of ballooning degeneration with the ground glass changes in the nuclei. And the treatment is for sure acyclovir or can use foscarnet in resistant cases. The Candida esophagitis has the appearance of yellow nodular plaques with surrounding erythema, which is طبعا diagnostic issues mainly يعتمد على endoscopic treatment usually by using the fluconazole therapy. أما ال HIV alone can cause esophagitis that can be quite resistant to therapy, and an OGD the ulcers appear as a deep and linear. Treatment is with thalidomide or oral glucocorticoids يبقى mainstay or use the highly active antiretroviral therapy should be considered. راح اعطي صور حتى واحد يباوعها ممكن يشوفها مره واحده بينساها. سلايدات الصور اذا حاطها دكتور مصطفى عفوا. هذا typical for patients who has العفو قبل السلايد اللي قبله. هو typical for patients who have candidiasis وهذا هو typical for patients who have herpes. هذا الصوره بالاخضر هو بالنيروباند ايمج. تباوعها it's ulcers punched out مثل ما تشوفوها. والصورة اللي بعدها حنشوف ان انا السايتوميجالوفيروس ان انا باليمين على اليمين الشاشة حتشوفوا يطلع بهذه الطريقة. تكون الالسرز على شكل serpentuous ulcerations. طبعا ال 1A هي severe وال 1B هي mild to moderate. Question 15. A 51-year-old man presents with a 2-day history of bloody diarrhea. having experienced watery diarrhea for 2 days before the appearance of the bloody stools. The patient has not received antibiotics recently. On examination, he is afebrile with mild non-specific abdominal tenderness and active bowel sounds. Lab studies revealed normal serum white BCs and stool samples showing many fecal leukocytes. What is the most likely cause of symptoms? A. Clostridium difficile. B. Salmonella. C. Campylobacter. D. Shigella. E. Yersinia. الإجابات
تايمز اب دكتور.
time's up. اقطع. طبعا الإجابة هي C. Campylobacter infection acute by يسموها ليش التريك أنه it is a biphasic diarrheal illness. كلمة biphasic which initially start as watery and subsequently bloody diarrhea, and there are many fecal leukocytes on the stool analysis. Such a biphasic presentation may be seen in Campylobacter and Shigella infection. But Campylobacter is more common than the Shigella, especially in patients without risk factors for Shigella infection such as daycare exposure. يعني إذا أردت ألوفه وأقول هذا patients عنده مثلا قاعد بنرسري أو قاعد بمكان مال عجزة أو أي شيء، فراح يكون جوابه Shigella باعتبار risk factor. They are associated with the Yersinia and Clostridium difficile is usually a biphasic illness. هاي هي الترك بالسؤال. Question 16. 22-year-old male recently received diagnosis of extensive ulcerative colitis. Colonoscopy at the time of diagnosis show mildly active disease throughout the colon with no evidence of dysplasia or polypoidal lesions. He began therapy with mesalazine and about 2.4 grams per day. Routine blood work shows an elevated alkaline phosphatase level. He undergoes MRI and is given diagnosis of primary sclerosing cholangitis. When should he undergo his next colonoscopy? A, in 8 years, B, in 2 years, C, in 6 months, D, in 1 year, E, in 5 years. الإجابات
تايمز اب دكتور.
time's up. جواب هو D, in 1 year. ليش؟ إنه دول البيشنتس اللي هم عندهم ulcerative colitis وعندهم other associated factor primary cholangitis، فالسيكونس of follow up راح يعتمد إنه يكون 1 year، وهذا هو سكيم يعتمد على السكرينينج كولونوسكوبي at 10 years إذا كان low risk، وهذا الديفينيشن مال low risk if it's not active ما عنده any endopathological inflammation and dysplasia or كان بس left side colitis أو عنده Crohn's colitis of less than 50%، هذا يكون 5 years. الانترميديate risk إذا كان mildly active and or post-inflammatory polyps or have any positive family history of C-reactive protein colorectal cancer، هذا راح يكون 3 years. otherwise إذا كان عنده primary cholangitis أو عنده structure in the past 5 years أو any dysplasia in the 5 years أو any patients have family history of cancer يراد له يعني تركيز بس ما ينحفظ بس على الأقل ينحفظ الهاي ريسك اللي هم هذول البيشنت يحتاجون الفريكونسي أو فولو أب in 1 year. طبعا هنا بيترك انه اذا كان بيشنت عنده جاست اذا جاك سؤال بس rectum involved by ulcerative colitis فالسكرينينج حيكون protocol is the same as the normal population because the risk is near zero for regard the malignancy يعني يبقى يعني اذا كان يعني ما عنده اي risk factors for every 10 years هو راح يكون follow up. The rectum is only the rectum is not a risk factor and no need for the specific question 17. "62-year-old women with ileocolonic Crohn's disease presents with worsening diarrhea, stools of oatmeal consistency, bloating, nausea, and weight loss. On physical examination, lower extremities, there is an edema is present. Laboratory test results are as follow. The albumin was 2 grams per deciliter, AST was 56, ALT 48, alkaline phosphatase 300, and decreased gamma globulins. A colonoscopy is performed and congruent staining from rectal biopsy confirmed diagnosis. Extracellular tissue deposition of which of the following protein is responsible for this patient disease process? A, serum amyloid A protein, B, beta-2 microglobulin, C, immunoglobulin light chain fragments, D, myoglobulin, E, collagen. الإجابات
تايمز اب دكتور.
times up. الإجابة هي A, serum amyloid A protein. طبعا هو مبين case of amyloidosis إذا ممكن discussion. طبعا هذا الفورم secondary form of amyloidosis باعتباره patient عنده inflammatory bowel disease. Secondary amyloidosis occur with the chronic inflammatory disease, not only IBD, rheumatoid arthritis, and the chronic infection, familial Mediterranean fever. And secondary amyloidosis can affect any organ, although the kidneys is involved. The AA amyloid fibrils is derived from serum amyloid A type of protein, an acute phase reactant. طبعا هذا الانديكيشنز فور امبليتري esophageal pH monitoring هذا هيك في الاجابه يعني اجى على غير موضوع بس يعني اجى البوكس بالغلط على غير موضوع اخر فنذكره بعدين بوقته ان شاء الله. Question 18. "51-year-old male complain of heartburn and acid regurgitation for 2 years. He has dysphagia for solids and points to the lower sternum as a site where he senses food gets stuck. He has not lose weight. His heartburn responds to antacids. Complete blood cell count results are normal. OGD revealed severe erosive esophagitis with sliding type of hiatus hernia and lax cardia. Which of the following is the next appropriate answer? A, ambulatory esophageal pH impedance test. B, esophageal manometry. C. Nielsen fundoplication. D. barium swallow. E. PPI trial.
Time's up دكتور.
Discussion. طبعا in such scenario, anti-reflux surgery is one of the important keys in the management. The first important step key to assess esophageal is to assess esophageal motility, to exclude hypomotility, achalasia, and esophageal gastric junction outlet obstruction or ineffective esophageal motility. And it's very important to calculate the CDI ratio. CDI ratio, which means that the pressure that the patients may need to know that if he has a reserve power after the swallowing. pH metry is important to assess if a significant pathological reflux, like acidic or non-acidic, present. If non-pathological reflux and partial or poor response to PPI, then the anti-reflux option would have a poor outcome. So the answer is the esophageal manometry. We should do esophageal manometry first before going to another step. الغاية من عنده حتى نعرف إذا كان البيشنت عنده abnormality within the esophageal motility or not. Since that the most important causes of erosive GERD has been related to the disorders of the motility rather than the reflux issues itself. Question 19. هذا السؤال قبل الأخير. 35 years old man has chronic hepatitis B. He come to the United States from Somalia at age of 20. He is asymptomatic. His only brother has also hepatitis B. He denies any family history. Which of the following should you advise? طبعا هذه هي الانفستيجيشن. ALT 20. HBS antigen was positive. IgG anti-hepatitis B core antibody was positive. Anti-hepatitis B E antigen was positive. Hepatitis DNA viral load was about 2000 and liver ultrasonography was normal. What is you advise the best? First, non-invasive liver assessment, fibroscan. B, prescribe tenofovir. C, prescribe PEG interferon. D, perform liver ultrasonography every 6 months. E, perform liver biopsy.
Time's up دكتور.
Time's up. ممكن discussion. طبعا هيك patient عادة هو نسميه inactive. diseases of hepatitis B مثل ما عرفنا انه البيشنت يصير يعني يقسم الى active و inactive. بعد ماكو هذا الكيس انه يعني التقاسيم القديمه. طبعا even though treatment of hepatitis B would not be advised اكيد لانه African patients with hepatitis B have high enough risk for hepatitis C that surveillance is advised in those older than 20. Patients in inactive carrier states generally do not require any liver biopsy. So in such, we need to do a non-invasive test by doing fibroscan حتى نعرف state of fibrosis. لأن إذا كانت state of fibrosis is high, this means that we rethink again to start or not start GIT. مصطفى السؤال 20 متى يطلع؟ اوكي السؤال الأخير. 53-year-old man comes for hospital follow-up. He presented with upper gastrointestinal bleeding 8 days ago and had esophageal variceal ligation. Since dismissal 3 days ago, he has done well without any further bleeding and denies fluid retention and alteration in the mental states. Physical examination is notable for scattered spider angioma, large left lobe of the liver, and splenomegaly. Laboratory tests as shown: hemoglobin 10, platelet 69, INR 1.2, ALT 63, total bilirubin 1.8, albumin 3.1, creatine is 1. The S antigen for hepatitis B was positive, IgG positive, NTE, hepatitis E antibody positive, viral load 1,900. CT shows nodular liver, no enhancing liver mass, splenomegaly, and recanalized umbilical vein. Which of the following should you advise now? A. ambulatory esophageal pH impedance. عفوا مصطفى العفو هاي مو الإجابات مال السؤال 20. أنا آسف. وخلل.
سوري دكتور اني راسا كوبي بيست.
اي لا عادي ماكو مشكله. هذا سؤال يلغى، انا اعتذر. هذا صار خطا مطبعي. هذا اجابات مال غير سؤال، ماكو اشكال عيني. هذا سؤال يلغى، ماكو مشكله عيني.
حاضر.
انت عندك سؤال احتياط؟
يس الاخير بعد واحد.
خلي السؤال الاخير هو هذا اللي نحسبه، هذا الغيه.
تم دان.
اوكي هذا السؤال الاخير خلي يكون، يعني صارت شويه خرابيط ما يخالف. 60 years old man who originally immigrated from Laos received diagnosis of chronic hepatitis B infection with liver cirrhosis 5 years ago. He takes tenofovir to suppress the hepatitis B virus infection. He has been in a surveillance program for hepatitis C cancer with liver ultrasound and alpha-fetoprotein test every 6 months. 1 month ago, surveillance abdominal ultrasound showed there is a new 2.5 cm mass in the lateral left lobe of the liver. On confirmatory multiphasic MRI, the mass show arterial phase enhancement and portal venous and venous phase washout. There is no evidence of portal or hepatic vein involvement or extrahepatic spread. Serum alpha-fetoprotein was 100. طبعا إذا واحد ما يعرف الألفا-fetoprotein فهو normally less than 5. The patient has no major comorbidity that would be preclude the surgery. His MELD score was 11. الperformance status طبعا ECOG وperformance the functional performance status was 1. What is the optimal therapy for this patient? A. radiofrequency ablation. B. percutaneous ethanol injection. D. orthotopic liver transplant. D. surgical resection. E. transarterial chemoembolization. مصطفى شويه اخر يعني 20 ثانيه اخر اللانش اوف الاجابات.
حاضر دكتور.
هسه اسوي اجابه لانش.
خلصت 30 ثانيه دكتور.
اوكي تايمز اب. الدسكشن. طبعا هذا راح يخلينا يعني نروح على شيء يسموه الميلان كرايتيريا. طبعا هذا الاجابه هو liver transplantation باعتبار تيومر single and less than 5 cm. واذا كان البيشنت عنده 2 to 3 tumors and it's not more than 3 cm and no vascular invasion and or extra hepatic spread. هذا هي الميلان criteria of the indication of liver transplantation in patient who have hepatocellular carcinoma typical. طبعا other criteria اللي هي UCSF criteria ب 2001 قالت شويه غيرتها، قال اذا single tumor less than or equal to 6.5 or 2 to 3 lesions not exceeding 4.5 with total tumor diameter less than 8 and non-vascular invasion and extra hepatic spread. بعضهم يمشون على الكرايتيريا الثانيه بس غالبا هم الاغلب يمشون على ميلان كرايتيريا. سو الاجابه هي تكون orthotopic liver transplantation. طبعا اعتذر عن الاطاله، ارجو ان تكون الاسئله معقوله الى حد ما. طبعا بها اشياء سهله وبها اشياء نوعا ما متوسطه، ولكن خلينا نقول نعتبر انه هذه هي بدايه هي يعني كتعريف للاسسمنت اوف بورد بيكون بهالليفل. راح يكون تقريبا هيك الاسئله وتكون هي مراجعه الى المعلومات المتعلقه بالجاستروانترولوجي. شكرا لكل من شارك. اشكركم واشكر التفاعل. طبعا الدسكشن هذا راح يكون مسجله وان شاء الله راح تكون على اليوتيوب. طبعا نشكر الاخ الدكتور مصطفى نمير السبونسرنج لهذا الميتنج، وان شاء الله نطمح المزيد.
العفو دكتور، واجب.
شكرا جزيلا. طبعا نشكر دكتور ياسر ايضا. لا عفوا. طبعا دكتور ياسر عباس ايضا من المقيمين الشطار اللي ساعدنا بالموضوع، وان شاء الله راح تكون واضحه من خلال اللي يطلع على الموضوع على شكل ديسكشن. واذا عندكم اسئله يعني ان شاء الله كل ما انا اكون من الجميع على خير.
عاش يزيدكم عندي استاذ، رحمه الله والديكم. تصبحون على خير ان شاء الله.
مع السلامه.
عفوا. اهلا وسهلا.